Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about postpartum afterpains, stomach pain, common causes, what to do and when to call a doctor. At the end of this video you will understand better how to handle it and ease symptoms while caring for your newborn and yourself. You certainly expect to be sore and exhausted after childbirth, but you might not expect postpartum stomach pain. During the postpartum period, the first 6 weeks after delivery, lower abdominal pain is usually caused by afterpains, constipation, or C-section healing. While uncomfortable, it is typically not dangerous. Afterpains. After delivery, the uterus contracts and shrinks back to its normal size. As this happens, it can cause some lower abdominal cramps that are referred to as afterpains. These pains can feel like menstrual cramps. If they are severe, contact a healthcare provider for an evaluation. For most women, these pains are most intense in the first week after giving birth. However, the uterus can take as long as 6 weeks to return to its pre-pregnancy size, so you may feel afterpains throughout this period. The pains will typically be stronger when your baby is breastfeeding. Nursing stimulates the release of oxytocin, a hormone that triggers the uterus to contract. If this is your first baby, your afterpains will likely be less severe than they are in women who have had more than one pregnancy. This is because someone who has given birth more than once will have less muscle tone in their uterus. What to do? You can't prevent afterpains, and it's important that your uterus contracts and goes back to its pre-pregnancy size. You can, however, treat afterpains by applying a warm heating pad or hot water bottle to your abdomen. If your doctor gives the okay, you might want to take an over-the-counter pain reliever such as Motrin, ibuprofen, or another nonsteroidal anti-inflammatory drug, NSAID. Constipation. Postpartum stomach pain can also be caused by constipation. There are several potential causes of constipation after giving birth, and figuring out which one is behind your symptoms will help you find the best way to manage it. Reasons for postpartum constipation include low-fiber diet, hormonal changes, stress, reduced physical activity after delivery, vaginal tears or a bruised perineum, the area between the anus and the vagina, from labor, hemorrhoids, which are common during pregnancy as well as during the postpartum period, pain at an episiotomy site. Medications are another potential culprit of constipation after delivery. Anesthesia and opioids used for post-labor or C-section pain can cause constipation or make it worse. Certain vitamins, such as iron, can also contribute to or worsen constipation. Constipation usually improves in the postpartum period, as opposed to during pregnancy when the uterus is pressing on the colon. What to do? Eating lots of fiber. For example, fruits, vegetables, beans, legumes, nuts, and whole grains, and drinking plenty of water during pregnancy and in the postpartum period are critical for preventing constipation. Getting enough fiber and staying hydrated might be all you need to ease your postpartum bowel woes. If not, exercise can also help. Before you start doing any physical activity, ask a healthcare provider if it is medically safe for you to do so. When you can return to exercising will depend on the type of delivery you had and how active you were before and during pregnancy. Start by taking short walks. Put your baby in a stroller or carrier and head out for some fresh air, which will be good for both of you. If you have hemorrhoids, taking warm sitz baths might help. You can also soothe pain in the vaginal or anal area with an over-the-counter pain reliever. Again, check with your doctor or pediatrician first, especially if you are breastfeeding, or by using ice packs. If you haven't had a bowel movement for more than a couple of days, let your doctor or midwife know. They might recommend that you take a fiber supplement, stool softener, and/or laxative. C-section healing. Postpartum stomach pain can also happen following a cesarean birth, C-section. It's common to experience mild cramping as the incision and internal wounds are healing. It's also normal to feel some pain or soreness around the incision, especially in the first few days. What to do? The best thing you can do after a C-section is to ensure you get enough rest and avoid putting too much strain on your abdomen. Lift nothing heavier than your baby. If you had a C-section, be sure to take pain relievers as prescribed and directed by your doctor during your postpartum recovery. To allow time for your incision to heal, ask friends and family members to help out with meals, housework, and other tasks, as long as they don't hinder your need for rest. If possible, hire professionals to take care of bigger tasks like yard work, shopping, and cleaning. That will give you the time and energy to focus on your healing and your new baby. When to call a doctor? If your postpartum stomach pain is intense, persistent, or not alleviated by the suggestions given, please call a doctor. If you experience any of the red flag symptoms below, please seek immediate medical care. These signs and symptoms can indicate complications such as infection and hemorrhage. Postpartum symptoms that require emergency medical attention include excessive or bright red vaginal bleeding, fever, nausea and/or vomiting, pain that is severe, persisting, or worsening, redness, tense skin, drainage or swelling around a C-section or perineal incision, abnormal vaginal or rectal discharge, tender areas on your sides, headache, chest pain or difficulty breathing. The postpartum period is one of adjustment and healing. Even when you have help, it is not always easy, physically or emotionally. Try to be proactive about treating your symptoms and resting as best as you can. Make sure that you follow up with your obstetrician or midwife for your postpartum appointment. Within 3 weeks of birth, the American College of Obstetricians and Gynecologists recommends a second, comprehensive postpartum visit no later than 12 weeks after birth. This is an important time to discuss your recovery, which should include your mental and physical health, contraception, and any other questions or concerns you have. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.